Okay, so I'm currently at my Omnicell in the medication administration room. So I'm going to be looking between my Omnicell and my MAR chart, and this is going to be my first check for the medications. So I'm going to go ahead and see what I'm ordered. I'm ordered 10 milligrams by mouth of lisinopril, and I have a 20 milligram tablet available. I have 9 units of regular insulin and 16 units of NPH insulin. I'm going to look, I have multi-use bottles for both regular and NPH. I have to deliver a tuberculosis test, 0.1 milliliter, and I have a 0.1 milliliter vial available. I have to give 330 milligrams per milliliter for ampicillin, and I have available 1 gram of powdered vial and 5 milliliters of distilled water to reconstitute it with. And I have 2 orders for morphine, but I don't think that this is correct. There should not be a duplicate order. So I'm going to go ahead and check my med book, find morphine in here, and looking for it. I noticed that my patient is opioid naive, and that recommended in here is 4 to 10 milligrams, and since she's rating her pain at a 9 out of 10, I'm going to go ahead and I'm going to call the doctor and ask that we completely get rid of our 30 milligram IM stat, and we completely discard that and we change our 15 milligram IM stat to a 10 milligram IM stat to deliver to her. So I'm going to go ahead and call the doctor on my phone. So ring ring. Hello, Dr. Johnson, this is Hailey. I'm the nurse taking care of Miss Betty. Do you know who she is? She is a 45-year-old Hispanic woman who came in last night due to abdominal pain. She has a new diagnosis of diabetes. Do you know who I'm referring to? Yes? Okay, great. I noticed on my MAR sheet that you had a duplicate order for morphine sulfate IM stat. I am recommending that we completely discard the 30 milligrams IM stat and we change the 15 milligram IM stat to a 10 milligram IM stat. Does that sound okay? Yes? Okay, great. Just to reiterate, I am changing the 15 milligram IM stat to now morphine sulfate 10 milligram IM stat, and we are completely discontinuing the 30 milligrams. Is that correct? Yes? Okay, great. I'm going to go ahead and administer that to her. Thank you. Okay. So now I'm going to go ahead and pull up all of my medications here during this first check too. So I'm going to pull out my morphine, and I'm going to make sure I'm checking the expiration date on it. So I have my 1 vial of morphine. I have my 20 milligram tablet of lisinopril that I pulled up. I have my tuberculosis vial of 0.1 milliliters, and I'm going to be checking the expiration date on it, and that's all good. I have my regular insulin and my NPH insulin, both those vials I pulled up, and I'm checking the expiration dates on both. And then I have my ampicillin powder that I pulled up, and the expiration date is also good on this. And I have my 5 milliliters of distilled water to reconstitute it with. And looking here at the powder vial, I know I have to reconstitute this with 2.5 milliliters when I get to that. So I went ahead and I completed my first check, and now I'm going to bring in all of the supplies and everything, and I'm going to go ahead and enter the room. So I'm going to knock, and I'm going to come in to the room. I'm going to introduce myself, close the door for privacy. Hello, my name is Hailey. I'm going to be your nurse today. Can you please give me your name and date of birth? Okay, Miss Betty, great, thank you. Okay, today we're going to be giving you and administering your medications to you this morning. Does that sound okay? Yes, okay, I'm going to go ahead and drop all the medications and get them ready to be administered to you. Sound good? Yes, okay, I'm going to go ahead and wash my hands and put on gloves. And before I start getting these medications ready, Betty, I'm going to give you your 10 reps of medication. Okay, so your first one is I'm confirming I have the right client, which I just did. I'm going to make sure I have the right medications. I'm gonna make sure I'm giving them at the correct time with the correct route and the correct dosage. So right client, right medication, right time, right dosage, right route. I'm gonna make sure I'm providing the correct education. I'm making sure that I'm giving the right documentation. You have the right to refuse any one of these medications. I'm going to make sure you have the right reason as to why it's being administered, and that you have the right evaluation once these are all administered. Okay, now I'm going to go ahead and start drawing up my medications. So I have my MAR down here. Okay, so first I'm going to get ready my morphine sulfate, because that's what I'm going to administer first. So for this one I have to do some dosage calculations. So I've changed this order to 10 milligrams, and I have available 20 milligram to 1 milliliter bottle. So I'm going to go 1 over 20 times 10 over 1, and so that gives me 10 over 20, which is equal to 0.5 morphine, and that's going to be milliliters. So that's what I'm going to go ahead and draw up on here. So I'm going to take my cotton swab. I'm going to wipe this all clean. I do this for 15 seconds. I'll leave that there. Now I'm going to take my filter needle here. I'm going to place it on my syringe. I'm going to take this right here. I'm going to uncap it. I'm going to go ahead and stick it in. I'm going to draw up 0.5 milliliters of morphine. Make sure I get out any air bubbles. Okay. So I'm going to pull that out. Going to recap this right here using the swoop method. I'm going to take this off, discard. I'm going to place on a new syringe tip. As you can see, that is 0.5 milliliters. I'm going to set that there to be administered later on a swab for the skin. Okay, so next I'm going to get ready my lisinopril. Oh, and while I was doing that, I was performing my second check, so I was double checking that my correct math matched up with my MAR and what I had taken from the vial, which it did. So my second medication I'm going to administer is my lisinopril. So I'm going to go ahead and wipe off my cutter to make sure there's no residue left over. I'll cut myself. Okay, I'm going to throw that to the side. And so now with this, I have a 20 milligram pill available, and I need 10 milligrams. And so just by doing the math in my head, and I checked it with another nurse, and I also checked this math with another nurse, I'm going to cut my pill in half along the scored line, and 1/2 of the pill will be 10 milligrams, and that's what I will be administering. I'm going to go ahead and get out my pill, place it in here, make sure it's lined up right, cut it in half. I'm going to take 1/2 of the pill, put it in my container, and set that aside along with some water, because that's what I'm going to be administering. And the other half of this, I'm going to go ahead and dispose of per my facility's policies and set that off to the side. And I did my double check on that by making sure I got 10 milligrams out of my 20 milligram tablet, and double checking that I had the right medication. Okay, so now I'm going to go ahead and prepare my tuberculosis test. So I'm going to go ahead and swab clean the top. This for 20 seconds, or 10 to 15 seconds. I'm going to leave that on there. I'm going to prepare my syringe. And I'm going to be getting 0.1 milliliters because I've checked on here. I need 0.1 is my order, and I have available 0.1. So I'm going to go ahead and draw that up, and I didn't have to do any math for that one. I'm going to take this off, uncap this, move it over, and I'm going to inject 0.1 milliliters of air into it, and then I'm going to make sure I'm pulling back 0.1. I'm going to recap it. You see I have 0.1. Okay, I'm going to go ahead and set that off to the side. That was my second check performed with it. Let's set other alcohol swab there. Next, I'm going to be preparing my insulin. So I'm going to go ahead and double check with this and write out my math. So I need 9 units of regular insulin and 16 units of NPH for a total of 25 units. And I had that math double checked with another nurse. So I'm going to go ahead and roll out my NPH vial to just get everything all mixed up good again. And for the heck of it, I'll just roll my regular insulin too. So I'm going to go ahead and wipe clean both of these with separate swabs. Okay. So for this one, I'm going to start with my NPH, and I'm going to draw back 16 units of air. It's kind of hard to see. There, and I'm going to inject this into the NPH without touching the solution inside of it. We're going to go here. Put in the air. Okay. And then I'm going to go ahead, recap that quick, and get another alcohol swab ready, and wipe it down again and set that on top. And now I'm going to pull back 9 milliliters of air, or 9 units. And I'm going to uncap my needle again. I'm going to take my regular insulin. I'm going to inject the air and then draw back 9 units of regular insulin. There, make sure there's no air bubbles. Go. Okay. See, I've got 9 units right there. Can you see that? Yeah. Okay. So now I'm going to move this off to the side, and now I'm going to pull up 16 units of my NPH, but I cannot pull past that or else I'd have to start over. So I'm going to pull back to the 25. There. Sure there's no air bubbles. I don't see any. I'm going to go ahead and pull this out, and I'm going to safely recap my needle again. I've got a total of 25 units of insulin. I'm going to set here. That. Set this outside. So next I have my ampicillin that I have to reconstitute, and I did my second check on all those medications, making sure they're all right. So for this, I need 330 milligrams per 1 milliliter. I'm looking at the vial. It says I'll get 330 milligrams per 1 milliliter if I dilute it with 2.5 milliliters. So with my 5 milliliter dilute, I'm going to go ahead and put on a filter needle, and I'm going to pull up 2.5 milliliters of air. 2.5. I'm going to inject it into my dilute. Okay, and then I'm going to pull back. Once I find the numbers. 0.25. Move this bubble up to the top. Okay, I'm gonna pull back past there, so then that way work on getting this last bubble out. Okay, go. So I have 2.5 milliliters of dilute, and I'm going to recap this because I forgot to take off the top, the other one. And before I would have pulled that up, I would have wiped it down with an alcohol swab. Forgot to do that, but I would have done that. And now I'm going to open this. I'm going to go ahead and wipe it down. Okay, I'm going to uncap this. I'm going to inject it in to my powder. I'm going to recap this. Remove my filter needle. I'll put it in this safety box. I'm going to twist on my new needle. Okay. In reality, I would not have actually done that. I would have kept my filter needle on until I drew this up, and then I would have switched it when I had this drawn up, but I did that wrong. Okay, so reading this vial, I'm going to go ahead, and it says that I can shake it, so I'm going to shake it and roll it to make sure everything gets all mixed up good. And because it's 330 milligrams to 1 milliliter, this is 330 grams to 1 milliliter, I'm just gonna pull up 1 milliliter of ampicillin, and I've had that verified with another nurse too. So I'm gonna go ahead and set that off to the side. I'm going to clean the top off again since I touched it. And I'm going to take my needle now. I'm going to pull back 1 milliliter of air. I'm going to inject this in. Invert it. I'm going to pull back 1 milliliter. Pull that out. I'm going to go ahead and recap this. And like I said, I would have in reality kept my filter needle on, drawn this up, and now I would have switched it to this needle. I did that, and I have 1 milliliter. Okay, so I have all of this ready now. I've had all of my dosage calculations double checked. I've done now my second check of all of the medications, and so now I'm ready to administer them to Miss Betty. So I'm going to pull this over here with me. Okay, Miss Betty, how are you feeling right now? We're about ready to start administering your medications, okay? So the first medication, and remember you have the right to refuse any of these medications. So the first medication I have to administer to you is morphine sulfate. And so I have this medication for you because you came in and you were rating your abdominal pain as a 9 out of 10. And this morphine is going to help eliminate some of that pain for you. And so some of the effects that you can feel from this morphine is going to be respiration depression. So we're going to be making sure to watch respiration and oxygen intake. You're going to feel some sedation. Hopefully it's going to help get rid of your pain. You're going to feel some dizziness and possibly confusion. And because of this, we're going to have you labeled as a fall risk. So if you have to get up and ambulate or do anything of that sort, please let us know and we'll come in here and assist you with that, okay? I need my pad. Okay. And for this medication, we're going to be administering it here on your vastus lateralis, which is here on your thigh. So I'm going to go ahead and lower you down and raise the bed so I can actually. And so before I administer this medication to you, I double check that you're the right client. I have double check the medication and I'll check it once more again before I administer it to you. I've double checked the right route because it's administered through an IM, which is an intramuscular injection. I will document this once I'm done giving you all of your medications. I've explained to you the reasons for it. I'll come back and evaluate you here in a little bit once I've administered all of the medications. I've educated you on it too. Okay, so we're going to go ahead and pull this back right here, and I'm going to expose your thigh. So I'm going to find your vastus lateralis by finding your hip bone and placing my hand there, and just above your knee, placing my hand there. And so I'm going to be injecting your thigh right here in this area. So I have this. I'm going to open this. I'm going to clean off the area. And I'm going to make sure to let that dry before I stab you. Okay, so now that that's dry, that is dry, I'm going to go ahead and uncap this and do my third medication administration check. So I have 0.5 milliliters of morphine and I need 0.5 milliliters of morphine. So I perform the third check. I'm going to do the Z track and kind of pull your skin taut here. And on the count of 3, I'm going to go ahead and poke you with the needle and administer the medication. 1, 2, 3. I'm going to pull it out. And I'd have a cotton swab that I'd put over that and a Band-Aid. I'm going to close the safety cap on it. That should not be sticking out like that. And I'm going to go ahead and dispose of this in the sharps container. And I make sure to cover that with the Band-Aid stuff for you. Okay, great job. So now we're going to move on to your next medication. And for this one, I'm going to go ahead and sit you up again. And so next we're going to be giving you your lisinopril. And this is because we noticed, thank you. This is because we noticed you had elevated blood pressure when you came in 150 over 88. So we want to go ahead and bring that down. So we're giving you lisinopril. And I was ordered to give you 10 milligrams by mouth. And this is what I have is half a tablet, which is 10 milligrams. So that's my third check. So with this medication, like I said, we're giving it to you to lower your blood pressure. And along with that, some side effects you should be aware of is that lisinopril causes, it can cause hypotension, cough, dizziness, fatigue, and all of that. So we're going to be monitoring you for all of those symptoms. And let us know, since it's taken orally, if you have any mouth sores, a rash develop at all, any mouth sores, a sore throat, dry cough, anything of that sort, please let us know. So I want you to go ahead and swallow just so I can make sure you can. Great, thank you. And you feel like you can take this medication without assistance? Yes? Okay, I'm going to go ahead and give medication to you. I'm going to give you some water along with it. Okay. So with that medication, I made sure you were the right patient. I verified it was the right route, which it was orally. I gave you the correct dosage at the correct time. I'm going to go ahead and document this afterwards. I educated you on it. I told you the reason you're going to be having it. I let you know earlier you have the right to refuse any of this. I'm going to come back and evaluate you later, and I stated the reason as to why we're giving it to you and educated you on it. Okay, so now we're going to go ahead and we're going to move on to your tuberculosis test. So with this test, it's going to be on your forearm here. And so I'm going to be injecting it transdermally. So that means that it's going to go right underneath the skin and there's going to be a little bubble that appears. Now with this, you're not supposed to touch it or scratch it or irritate it at all if you can help it. And then I'm going to come back and check it within 48 to 72 hours. And we're going to check to see if you have a reaction to it. And if you have any redness, bumps, like red bumps there, it's itchy, it's swollen, or anything at all, we're going to go ahead and follow up with some tuberculosis precautions. But if we come back and check it and it's completely normal, then that's all good and we're in the clear. I know you've been traveling recently. Have you had the tuberculosis vaccine at all? No? Okay. So I'm just going to go ahead and do my third check on this. I need 0.1 milliliters, and I have 0.1 milliliters within the bottle, within the needle. So I'm going to go ahead and pretend this is her forearm.
I have the other one.
I'm going to use this skin. I'm going to pretend this is her forearm, and I'm going to clean it off first. I'm going to let that dry. Okay, I'm going to uncap my needle. And I'm going to go transdermally, so like 1/8 right underneath the skin at a 10-degree angle. And I'm going to pull it taut just a little bit, and I'm going to bevel up. I'm going to go right underneath the skin. I'm going to push it in and pull it back out at the same angle, and then I'm going to mark that with a circle or something of that sort. I'm going to go ahead and dispose of this in the sharps container. Okay, how are you feeling, Miss Betty? You still feeling good? Yes, okay. I'm gonna go ahead and move this off to the side now. Okay, so next we're moving on to your insulin, because I understand that you are newly diabetic and your blood sugar is currently sitting at I'm gonna lay you back. Your blood sugar is currently sitting at 240 and we'd like to get that down. So I'm going to go ahead and administer to you insulin. We have 25 units of it, and this is hopefully going to help get your blood sugar down and get you feeling all good again. And I'm going to be administering this in your abdomen. So I'm just going to do my third and final check of the insulin, and I have 25 units in here, 9 regular, 16 MPH, and I have 25 units in the syringe. So that's my third check. So I'm going to go ahead and expose your stomach here. So we're going to be administering it here on the abdomen, right next to your nice stoma. We're going to have it right here. I'm going to clean off the area. Wipe it all down. So now while we let that area dry, I'm going to go ahead and educate you on the medication. So we're giving this to you to lower your blood sugar. And so some of the things we're going to watch for this are hyperglycemia. So that's when you're going to have fruity smelling breath. You're going to be nauseous and vomiting and all of that stuff, and hypoglycemia. So hypoglycemia is going to make you like shaky, kind of disoriented. You're going to be sweating a lot and stuff like that. Okay, so we're going to be watching for both of those things once we administer it to you. So I'm going to go ahead and uncap this and make sure I'm giving it to the right client, which I have, the right route, which is subcutaneous. It's the right time, it's the correct dosage. I've educated you, I've explained the reason as to why I'll document it once I've done all of the administrations of all the medications. So I'm going to go ahead and pinch the skin so I can get it into the fatty layer of the subcutaneous. And on the count of 3, I'm going to go ahead and poke you. 1, 2, 3. And I'm going to administer the medication. I'm going to make sure to leave it in for 10 seconds. I'm going to pull it out, and I'm going to cover that with a Band-Aid and a cotton swab, which I don't have. I'm going to put that in the sharps container, make sure I get rid of it properly. Okay, great job. I'm going to go ahead and pull this down, and we have one final medication to give, and that is your ampicillin. And so this one we're going to have to turn you on your side for it. But we're giving you ampicillin because we took your chest x-ray, and your chest x-ray showed pneumonia, and we want to go ahead and fight that, and ampicillin is going to allow us to do that. So with this one, you need to know that even when you start feeling better, you need to continue on with the prescription until it's completely gone. You need to keep taking it even when you start feeling better. And some of the things you need to watch out for this is diarrhea, if you feel like any fuzzy overgrowth on the tongue, vaginal itching, dizziness, and stuff like that. So please let us know if you're feeling any of that once it's administered. And I'm going to be delivering this on your vastus gluteus. And so I'm going to go ahead and flip you onto your side here so I can get the area. Okay, Betty, work with me. Okay. Please don't fall. Okay, so I'm going to be exposing the area here I want to be working with. And so to find this, I'm going to go ahead and put my hand down on the hip bone and find the top of the iliac crest with my middle finger. Spread my fingers out wide, and I'm going to be administering it right here where this big, nice muscle is on her. So I'm going to mark that place. I'm going to grab my injectee pad. Just going to put it there, and I'm going to go ahead and wipe this down. And I'm going to let that dry. So while I'm letting that dry, I'm going to do my third medication check. My ampicillin, I have 330 milligrams per milliliter. I have 1 milliliter in here, which is approximated to 330 milligrams, so I have the correct amount. I've verified the correct client, the correct dosage, the correct rate of time, the correct route. I'm going to go ahead and document afterwards. I've educated her on it. I've explained to her why she's receiving it. She knows she has the right to refuse, and I'll come back and evaluate her later. But I'm going to go ahead and uncap this. Okay, Miss Betty, I'm going to perform the Z-track method and pull the skin taut again. And on the count of 3, I'm going to go ahead and poke you with the needle and administer all of this 10 seconds per 1 milliliter, okay? So on the count of 3, 1, 2, 3, poke. Push it in slowly. Okay, I'm going to go ahead and pull that out, put on the safety thing for the needle, and go ahead and dispose of this. And I would put on Band-Aid and cotton swab, and on all of the injections I would have stabilized it while I was injecting it. So I'm going to go ahead and flip Betty back. Put her trach back in. I'm going to, okay, Miss Betty, we've now administered all of your medications. You should start feeling the therapeutic effects of them really soon. I'm going to come back between about 10 to 15 minutes to come check on you again to make sure you're still doing okay and you're feeling the right effects of everything. I'm going to go ahead and document that I did all of the medications. So once again, I'm going to document all of my 10 rounds. I'm going to document that I had the right patient, that I gave the correct medication, the correct dosage, the correct time, the correct amount. I educated you about it. I'm going to document all of them, which is what I'm documenting right now. I'm going to explain to you that you have the right to refuse any of the medications, that you have the right to evaluation, and you have the right to the reason as to why you're receiving the medication. So I'm going to go ahead and document all of those, and then I'll be back within 15 to 20 minutes again, once again, to just reevaluate you and make sure you're still doing okay. Cut.